Outcry tonight from employees at a local nursing home blowing the whistle on what they say is inhumane care. 11 Investigates Angie Moreski joins us live as you see with their plea for help. And Angie, this is unusual.
It is, David. I have been doing this for a long time, more than 2 decades, and it is very unusual for a group of employees to come forward like this and speak out. They say they are compelled because family can't be there right now due to the COVID crisis. So they are willing to risk their jobs to be the voice for residents who can't speak for themselves. As the sun begins to rise at Murrysville Rehab and Wellness Center,
you have veterans here, you have elderly.
The nurses' aides arrive to provide daily care for residents.
Mothers, fathers, grandfathers, grandmothers.
Morning, Cam. Morning, Chrissy.
But these women,
How long have you worked here?
41 years.
13 years.
18 years.
33 years.
collectively with more than 100 years of service, are sounding the alarm.
They're not getting the care that they deserve.
Are patients suffering?
Yes, somebody got to speak up for them, and and it has to be us because the families aren't in here right now.
COVID has forced all nursing homes to ban visitors for months to help stop the spread of this horrible disease. And this facility has managed to keep its residents COVID-free. But the employees say that's giving a false sense of security and providing cover for a deteriorating level of patient care.
They're not being showered.
People falling out of bed.
The men aren't being shaved.
People falling to where they fell out of their wheelchairs.
What if they need changed?
They might get it one time. Because
A day?
A day.
A total of 8 employees came forward to speak out on the record, not anonymously, about what they say is poor care caused by staffing shortages.
We have 22 residents apiece most days. That's for one person to wash, dress, get up, 2 meals, and they're being neglected because you can't get to everybody.
22 patients per aide on day shift is a lot. Experts say best practice for nursing homes is only half that to ensure proper care. But the employees say their repeated complaints were ignored.
I told the administrator I'm embarrassed of my work process because I can't do what I was trained to do on how to take care of these residents.
A review of state inspection records for Murrysville Rehab shows multiple complaints this year, but no disciplinary action taken by the state. The last inspection report at Murrysville where it was cited for violations was back in December of 2019. Some pretty serious stuff. Residents said he often had to urinate in his pants when staff did not respond to him in a timely fashion. Resident had not received a shower for weeks. Resident not out of bed all week. And a citation for not having sufficient nursing staff. That was December of 2019. Since then, for this year, the facility has been inspected 1, 2, 3, 4, 5, 6, 7, at least 7 times, but not once were they cited for any violations despite having monthly complaints.
I feel guilty for putting him here. I feel guilty.